Hello and welcome to the Ontario Health Connection. This month we are talking all about irritable bowel syndrome, or IBS. So many of us have heard about IBS before and know that it is a digestive concern. So this is pain, bloating, abdominal cramping, change in bowel movements, which can be looser stools, or it can be constipation, or it can be a mixture of both. So my name is Maille Devlin. I'm a naturopathic doctor and I practice virtually across Ontario. With my patients, the first thing I do if someone comes with a chief complaint of IBS is make sure it really is IBS. There are many other digestive concerns, things like celiac disease, Crohn's, colitis. Making sure that we have an IBS diagnosis correct is the first step. So when someone is correctly diagnosed with IBS, we then look at what are the contributing factors for this person. We usually look at nutrition and diet. Now, I'm very careful with diet when we talk about IBS because there are some very well-researched diets like the low FODMAP diet. However, this should only be used for a short amount of time and we're using this diet therapeutically. And so what can sometimes happen with any digestive concern, but specifically IBS, is individuals go on these diets and then they don't go back to, a more regular diet. And so they get very restrictive on their diets because they feel better, but we're not really treating that person. And then they end up really restricting. So doing a short-term low FODMAP diet while we work on healing the gut is something I often do. Sometimes we do more of an elimination style diet. So we find out what are the trigger foods for that person, take those out, work on healing the gut and add in some lifestyle changes and then slowly start to add those in. So these therapeutic diets should only be used short term or used to go back to when a patient starts having a flare up again. They should not be used continuously. While that diet piece is happening, we also really want to focus on stress reduction. So stress and anxiety are very linked to any sort of digestive concern due to our vagus nerve. So there's a long nerve, and this runs from the base of our skull and it goes all the way down and it connects with our gut. And so this gut-brain axis is very important whenever we're working on healing the gut. And so stress management, finding ways to cope with stress are one of the main areas of treatment as well for patients. Also increasing the amount of movement and exercise can be helpful. Looking at the environment, water intake, and kind of looking at a holistic approach for their lifestyle as well. So we often just zone in on diet, where it's really important to look at the whole picture whenever we're looking at gut health. And so the idea is we do this, elimination diet or low FODMAP diet for a certain amount of weeks. We start to add back in while working on healing the gut at the same time. So that's how I personally, as a naturopathic doctor, work on supporting my patients with IBS. Stay tuned for other practitioners to see how we can all work together as a team to help patients with irritable bowel syndrome.